As gifts are exchanged this Christmas season, medical experts are reminding parents of the risk of those tiny button batteries, what they pose to children. Those thin circular batteries can easily fit inside ears and noses, but the main risk is children swallowing the batteries. It only takes about 2 hours for a swallowed battery to start causing tissue damage. It can damage organs and burn blood vessels. If your child has swallowed a button battery, you need to give them something that you might have in your cupboard before promptly taking them to the hospital.
2 teaspoons or 10 milliliters of honey to the child. The cool thing about honey is that it's actually kind of acidic, so what it can do is neutralize the battery.
She says you should give the child 2 teaspoons of honey every 10 minutes until you get them to the emergency room at the hospital, where you should take them immediately.
What we don't want parents to do is to have the child vomit, eat or drink anything else, or stop at a grocery store to get honey on the way to the ER.
If you think your child has swallowed a button battery, they may spike a fever, start coughing or vomiting, or have abdominal pain. Children can even experience long-term damage that can lead to disabilities or, in some cases, even death.